Good afternoon, and this is also National Public Health Week. I am Ellen Jones, the Public Information Officer for the Anne Arundel County Department of Health. Welcome to the Health Department's COVID-19 Facebook Live broadcast. Today, our health officer, Dr. Nilesh Kalyanaaraman, is joined by the department's Behavioral Health Director, Sandy O'Neill. Signer Carrie Quigley is also here today. Together, they will provide answers to questions submitted by you in our Facebook AA Health comments or by email at covid19info@aacounty.org. Let's begin with a few public health updates from our health officer. Doctor?
Good afternoon, everyone. It's good to see you here again this week. Wanted to talk to you a little bit about some of the most important things that we're thinking about this week. I will start always with, as we're discussing COVID-19, of emphasizing the importance of each of your actions in preventing the spread of this and slowing it down. That the social distancing that we've done in terms of closing down non-essential businesses, increasing the distance between people to 6 feet, making sure that we're doing good infection control, so washing our hands or using hand sanitizer frequently, making sure that you're wiping down and disinfecting frequently touched surfaces, and then just this past week, suggesting that when you're out in public to use a cloth mask, that all of these actions are important. They continue to be important every single day, and are what's needed in order to slow down the spread of the virus. As part of that, testing is a critical piece. We get asked many questions about that every week, and testing is one of the cornerstones of how we are both caring for individuals who might be infected with COVID-19 or something else that is causing them to be sick, and also from a public health perspective, how we are understanding how far this is spread and where we need to focus our attentions and how we need to do those interventions in the community. To that extent, we see increasing availability of testing all the way from our hospitals to outpatient clinics to drive-through clinics. And last week we had 2 drive-through clinics in Anne Arundel County. One was at the MVA Veep site. The health department, ran that in concert with Maryland Department of Health. Last week that was on Monday, Wednesday, and Friday, and this week it'll be on Wednesdays and Fridays. We also have a Anne Arundel County Department of Health drive-through clinic at our building in Harry Truman. That's on Tuesdays and Thursdays. And we've set those up so that we can get people tested quickly. We know that's been a need, and we are acting on that. As part of that, when we get those test results back, if somebody is positive, we do what's called contact tracing. And that's where one of the staff at the health department will reach out to you if your test is positive, to talk to you about the isolation that you should already have been doing. If you were getting a test, you should be in isolation. But talking to you about the isolation you need to be in. So that means not having contact with others, not going to work or school or whatever it is if you have to do that in this environment, and making sure that we understand who you've been in close contact with, because those people need to be in quarantine. And quarantine is for people who don't have symptoms. Why is that necessary? When you have close contact with somebody and you have COVID-19, that person's risk is increased of having the virus. And as we have talked about a lot, it takes anywhere from 2 to 14 days for symptoms to develop, on average 5 days. And so people can be infected with this without knowing, without having any symptoms, and as we are learning, can even potentially transmit this without having any symptoms. And so if you've been exposed, quarantine is a really key piece of actually slowing down the spread of infection. And so that quarantine is a key part of our contact tracing. And so even if you weren't tested, you may get a call from the health department saying somebody you know who you've been in close contact with has COVID-19. We're going to need you to be in quarantine typically for 14 days since your last exposure to the person. And we realize this is a hardship for folks, both with the disease and without. And so we provide as many supports as possible, whether if you're able to isolate or quarantine where you are, we will support that. Make sure that you are able to get the meals you need, make sure you can take care of your hygiene. But if you're not able to do that, we'll work to make arrangements so that those things can happen. We realize that this is a challenging situation. Uh, but we also know that this is one of the most important ways we have to slow down the spread. As part of that, we also want to share data as to what's happening in the county. And to that end, we've put up additional data as to what's happening in Anne Arundel County on our website, aahealth.org. And that data shows the age range of people in Anne Arundel County who have tested positive. It shows a map of where we see the cases in our county. We're such a big county that if you live in one end of the county, let's say you live up in Glen Burnie where we're taping this right now, that's really far, and it might really far from South County. And we know that people think about their communities, and so we want to share that information so that you understand that context. But regardless of what that number is, the social distancing measures are going to be key to slowing that spread, whether you have 1 case or 20 cases in your community. It doesn't really matter. What matters is that you take these actions and be vigilant about them. The other part of the data is that it helps us understand where resources are going. And one of the things that we've talked about at the health department is health equity, so making sure everybody gets the care that they need. And in the best of times, that's a challenging issue to tackle. In these times, it's even harder. And so we are paying particular attention to that, and on Friday, we'll be bringing together community leaders to discuss what's happening and to identify ways to address any shortcomings that we are seeing in our communities, particularly those with the least access to care and those that have historically not had engagement with the healthcare system. And lastly, I do want to note that it is Public Health Week. Usually we have to explain what public health is. This week, I don't think we have to as much as we might otherwise. And so I want to take this moment to thank all of the members of the Anne Arundel County Health Department who have been doing tremendous work, have been working around the clock, and honestly, many of them have new jobs that they didn't have a month ago, to try to do as much as we can to do this testing, contact tracing, data, and so many other things to support you, the public, to support our county and our city organizations and government so that we can together slow the spread of the virus. And so with that, I'm going to turn it over to Sandy O'Neill, our Director of Behavioral Health.
Thank you. I am thrilled to be here again with you guys today and to have the opportunity to answer some of your questions. I think some of the questions that are coming in are certainly echoed by many of us who aren't sending in those questions, quite frankly. One of the things that the department is promoting is the social distancing, and one of the things we want to make sure is not lost during that time is remaining connected and that social connection. So a lot of the questions that we have been hearing have to do with how do we stay connected and how do we do that if we're not familiar with the technology? How do we do that when we're not used to having to reach out this way? So we're going to be talking a little bit about some things that we can do and can access to stay connected, and also answering some of the other questions that have just been coming up. Thank you.
Sandy, social distancing. What are some activities I should do alone, and what can I still do with my family?
So I think that is a great question to ask. All of us have a very different need for downtime. So some of us might need a lot more than others, and some may just need a little bit. So be sure that you're taking this time to ground yourself, to spend that downtime that you need to kind of connect with yourself and be that calm parent, that calm partner, that present person for someone else. And then spend time doing things with the people that you love or that you're connected with. This weekend, we did something new, which was we played a board game with my son who lives a couple of hours away using one of the video conferencing platforms so as not to advertise any particular one. And it was great. And we thought, why did it take the pandemic to figure out that we could do this? And, it was living room to living room, and we didn't have the travel and the tolls. So that was one way to stay connected with people who weren't in my house at the time, beaming in. And it was a lot of fun, something that we'll continue doing. But you can also, when you're taking that socially distant walk around your neighborhood, maybe you're talking on your cell phone to someone, or you are sending a text message. Not everyone has access to the internet and can do some of those more visual kinds of things, or have enough data on their plans, but most of us still have access to a phone, so we can have those phone calls.
Thank you, Sandy. And another special member of the family could be a pet. What is the emotional benefit in having pets, and is now a good time to have a therapy pet or foster animal?
Oh, great question. So I'm spending a lot of time on teleconferencing for work now, and my dog considers himself a very important part of all of my meetings, and has made an appearance at each one of those, either in voice or in person. So I think that having an animal in your life is very important. If you are considering getting an animal at this time, really do some soul searching about that, because that is a big commitment. I understand that there are some foster shelters that are still open, so if you're interested in fostering an animal, so you're not maybe ready to take that full-time commitment, but you would like to take on, while you're home at this time, an animal who is in need of a home, reach out to your local animal welfare organization and see what services that they're offering. I understand some are doing teleconferencing of their own, so you can get to know a pet that way, which I think is kind of cool. In terms of having a foster or a therapy animal, that's usually a much longer process and has to be guided by generally a therapist and a trainer and those types of services. If that's something you're interested in, I would certainly begin seeking it out, but that may be a longer term solution than trying to adopt or foster an animal right now. But making sure you have the time to devote to those animals. They do add a lot to our lives, but they also require a lot of our attention as well.
Thanks so much, Sandy. We always get a lot of questions about testing. So, doctor, who can get tested currently? What are the priority groups, and what type of test is being done?
So let's start with who should be tested. Only people with symptoms should even be considered for testing. If you don't have symptoms, there really isn't an indication to to test at this time. Because we still don't have enough tests to test everybody with symptoms, we're still recommending that only people with moderate to severe symptoms, so persistent fevers, shortness of breath, or a long duration of symptoms, get tested at this time. If you have mild symptoms, cough, some fevers that you can manage with medication, and you can stay where you are and manage your symptoms and not need further care, then we're not recommending testing at this time, understanding that as more tests become available, we may change that guidance. The test that we're doing, you'll see, is a commercial lab test if you get tested, which involves putting a swab into your nose to the back of your throat. It's a little bit uncomfortable, but it lasts about 10 seconds. That takes usually a few days, so we're seeing from anywhere from about 3 to 4 days to get results back. Hospitals have some testing. Some hospitals have testing now that they can get back the results in the same day, but those are limited to hospitalized patients.
Thank you. The next question is anything being done to test antibodies?
So antibody testing is in the news now. It's I believe the first test was approved just in the past week. At this time, we're not really focused on that because it's not really our key right now. Our key is to figure out who has symptoms so that they don't spread it, more so than who already had it. As it becomes more available, we'll certainly evaluate it ourselves as well as many others to see how it might fit into the care that we're providing.
Is it possible to have a false positive test?
It is possible to have a false positive. The false positive rate is very low, but it is theoretically possible, yes.
Okay, thank you. And contact tracing. This person asks, if I test positive, how will I be notified, and how do you contact my contacts and still protect my privacy?
So when you get tested, whoever did your testing should contact you with those results. Um, in addition, the health department will also contact you to make sure not just your care, but make sure that you understand the isolation and quarantine piece of this. Um, in terms of reaching out to your contacts, while we want to maintain your privacy as much as we can, we also have an obligation to slow the spread of this virus down. And so we do ask you for all your contacts. We want to make sure that we know who they are. If you have a privacy concern, you should certainly let our staff know at that time so that we can work with you on that issue.
Thank you, Doctor. Sandy, see, COVID-19 is traumatic to me, and I think I have PTSD. Is that possible, and what should I do?
So that is a really interesting question. If you are someone who is previously diagnosed with PTSD, then the concern and anxiety that you may be having over the current COVID-19 emergency may be triggering that. In terms of developing PTSD from this pandemic, research coming out of China is saying that it may be possible. So we're starting to get some data along those lines. Regardless, I think it can be very traumatic for people. So if you are someone who is experiencing a lot of stress and anxiety and it is interfering with your daily life, you're not able to do the regular things that you do or take care of the things you need to take care of or enjoy the activities that you used to enjoy, now's a good time to make sure that you are staying connected with the people in your life. And if that is not a good resource for you, it could be a wonderful time to reach out to a professional. There are a lot of professionals that are offering services right now that you can access through the comfort of your home. Anything that we can do right now to manage the anxiety, the trauma that people are feeling regarding the pandemic, the separation, the social distancing, the concerns of who does or does not have the virus can really be mitigated by talking to someone, whether that someone is in your family, in your network, or whether that is a professional. And that will go some ways to hopefully preventing later onset of post-traumatic stress disorder.
You mentioned counseling. Is it as good now with telehealth as it is with face-to-face counseling? And could you define telehealth, please?
So telehealth is something we typically do through a video format. So if you're familiar with FaceTime or Skype, and in fact, you can actually use those platforms right now, typically we use a different type of a platform, one that is HIPAA compliant and encrypted, but it generally involves having that type of a conversation between a mental health professional or a healthcare provider and the individual. At this time, it's pretty frequent that both individuals are in their own homes. So there are some slightly different nuances to engaging in that. Your therapist will have a different conversation with you at the beginning of that session. All of the other things still apply in terms of confidentiality, record keeping, all of those kinds of things. And then how effective it is going to differ by person. Some people are very, very comfortable, both the therapist and the person seeking the services are very comfortable interacting on that platform. And it's going to be as effective as if they were in person. For some people, they may prefer that when we are less socially distant, that they go back to in-office visits, and those are effective. So there's a high rate of efficacy from telehealth. It really involves engaging in that conversation with your provider to make sure you are as comfortable as you can be, and your therapist is as well.
Thank you, Sandy. A question about testing just came up. It's a very popular topic now. If you live in another county in Maryland, can you still get tested in Anne Arundel County?
It's a good question. So the health department, we're currently only testing Anne Arundel County residents, but you can get tested at urgent care centers if your doctor puts in an order to get tested at one of the MDH VEEP sites. There are multiple MDH sites around the state that are operational. And in your county, there's going to be different ways to get tested. So I'd encourage you to call your local health department to find out where you can get tested.
Thank you. We also have a number of questions about the spread of COVID. Is coronavirus spread through cash and change or debit cards? And what is the safest way to make an in-person purchase?
So this is a question about what can the coronavirus survive on. And what we generally see is that if it's on a porous surface, so something like paper or cloth or money, cardboard, we see that it generally can live for up to 1 day, so up to 24 hours. On hard, non-porous surfaces like metal or plastic, it can live for up to 3 to 4 days. And this is why we say make sure that you wipe down frequently touched surfaces, because those can harbor the virus for a long period of time. To answer your question about purchases, if you are using cash and you have to, that's why we recommend hand washing or hand sanitizer after those kind of interactions. You can wipe down your credit card as well. And many stores we're finding have those wipes available. And just make sure that in any situation where you're touching a frequently touched object, so if you're in a store, I don't think that transaction is the only time you've touched something. Make sure you're mindful of good hand hygiene and not touching your face.
And speaking of hand hygiene, how long would the virus last on your hands if you don't wash them?
That's a good question. Wash your hands. Then you don't have to ask that question. However, if you don't have access to hand washing or hand sanitizer, that's why we recommend not touching your face. And that's where those cloth masks can help, because they can actually be a barrier to touching your face. But that's not the recommendation. So wash your hands, please.
What types of solutions are recommended to clean and disinfect surfaces?
So you want to make sure that your product has at least 60% alcohol. That's what you're looking for on wipes. Soap and water work very well too. Soap is actually very effective in breaking down the virus. So if you don't have access to 60% alcohol, at least use soap and water to wipe down your surfaces.
Another pet question. What about my pet? If a tiger can get COVID-19 from someone, why can't Fluffy? How can I prevent the spread?
That's a great question. It's one of those things that we're learning more about each day. As we've talked about before, those of us in public health are getting information at around the same time that everybody in the public is, and that's not our normal situation. So as we learn more, we're sharing more. I believe it was this weekend, and Ellen just sent me this about the tiger was it the Bronx Zoo? Was that where it was? Yes. That tested positive for COVID-19, and there's some preliminary studies out of, I think, Germany showing that cats can get it. I think our best advice at this point is to essentially treat animals as you would treat other people. Consider that distance. If you're sick, try not to be near your pet. It's just as challenging as it is to not be around other loved ones. And if your pet gets sick, keep that pet away from other pets as well. That's a general recommendation just based on what we're starting to see and just trying to extrapolate to where we might be. But there isn't any firm evidence for that yet. So use your best judgment.
Okay, thank you. And this one is from a companion caregiver. In addition to masks, gloves, and hand washing, what practices should be followed by an in-home companion caregiver for the elderly or disabled?
So we mentioned, the questioner mentioned masks, masks and gloves. Um, it's also a good idea to keep that 6 foot distance as much as you can. There are obviously going to be moments where you're not going to be able to maintain that. Make sure that both you and the person you're caring for um, are washing hands and or using hand sanitizer as needed when you're having those frequent contacts, wiping down those surfaces. And then as well, this is all assuming that person doesn't have, neither of you has any symptoms. Remember that each of you are just as likely to pass it on to the other person. And that if that person is having symptoms who you're caring for, that you have that you have an idea of how you're going to manage infection control. And if you need help with that, you can certainly call the health department to get advice on how to manage that situation.
Thank you. And this has been in the news a lot lately, too. Could I use hydroxychloroquine to prevent or treat coronavirus?
So, right now, that is not our recommendation, and there's no evidence to suggest that it's actually effective. I'll note that there are a good number of people who are on hydroxychloroquine for their medical conditions, who need that medication for their conditions. And what we're seeing is when people are using it inappropriately, it's actually making it harder for those people who truly need it to get access to medications that's really important to keep their immune system in check. At the same time, hospitals have the discretion to, in individual situations, make that assessment as to whether they think there is any usefulness to that or not. But I want to reiterate, there is no evidence at this time that hydroxychloroquine is useful in either preventing or treating COVID-19.
Thank you. Back to Sandy. Sleeping. The question is, I am a healthcare worker and I work 16-hour days, but when I get home, I cannot sleep. What should I do to relax and sleep?
Well, first, thank you. Thank you for working those 16 hours a day to take care of those of us who need that care. When we are taking care of others, when we are working to the point where we're still feeling tired or wound up, getting that sleep, which is so important to your own health in terms of staying healthy, but also in terms of maintaining your personal resources and to be able to problem solve and interact with others in a civil manner, shall we say. I get a little snippy when I haven't gotten enough sleep. It's very important to do the things that are going to help you sleep. So those are going to be different for each of us. Generally, I recommend that someone who's having a difficult time sleeping, make sure that you're getting enough exercise. If during your 16-hour day you are getting enough movement that you're physically tired, and that's not the problem, it is more you're unable to unwind or relax, then maybe spend some time doing your grounding things. So grounding are those types of activities that we engage in that keep us in the here and now, that keeps us out of our head and worrying and overthinking about things. And those grounding techniques can be very different. I'm a therapist. Therapists often talk about breathing, something we all do all the time, but often when we are feeling worried or restless, we are not breathing well. So, take some time to calm your breathing, and that can help center you. You may be somebody on the other end of that being more physical is going to help you ground yourself. So making sure that you get in that physical exercise or the run or the thing that kind of keeps you going. If you are a quilter, do some time quilting. If you are someone who likes to solve puzzles, spend some time doing the puzzle. What we're trying to do is help you calm that worried mind so that you are able to become ease into sleep. So I think there are a lot of different things. If, however, after trying those things, it is not working, it may be time to talk to a professional so that he or she can help you come up with some things that would help you relax, unwind, sleep, and recover yourself.
Now, this question is the opposite. This individual asks, why am I feeling more tired?
People are funny creatures, aren't we? We tend to, sleep is one of the things that gets disrupted very quickly when we are out of sorts or unbalanced. So some of us go to, I can't sleep, and some of us go to, all I can do is sleep. I think that for some who are sleeping too much, I think it is recognizing a couple of things. It takes a lot of energy to go about our day. It takes a lot of energy when we are worried or focused on something that is uncertain, and that energy is draining. So doing some of the things I mentioned before to maybe get out of your head can be helpful. Also, set a routine for yourself. We get into habits of, if you have the privilege of being at home, you may not have a routine where you have to get out of bed in a certain time or go to sleep at a certain time. So set a bedtime routine that works for you. Go to bed about the same time every night and get up in the morning about the same time every morning. And if you still feel sleepy, still get out of bed and get moving. Whether that moving means taking a shower and putting your shoes on and moving to a different room. Or if that moving is getting involved in an activity, do something that is of interest to you or of purpose to you. So if you have a job and you're supposed to be working from home, tackle a task that day. If these things are not working for you and you are worried, or others in your life are worried that you are sleeping too much, again, I think it is time to call a professional and get some advice to help come up with some things that are going to work specifically for you.
Thank you, Sandy. We're still looking at exercise here. And doctor, when riding our bikes, do we still need to be 6 feet apart, and how is that possible? And do we need to avoid bike riders that come in close contact with us when walking?
So when riding your bike, that 6 foot between you and the other person is just as true as it is for any other activity. So one of the things to consider is where you're biking. Depending on whether it's a trail or along the on the road. Make sure you wear your helmet, by the way. But making sure that you have that distance is key. Obviously, there are situations where you're just not going to be, when you're passing people, whether it's pedestrian or another biker, you're not going to be able to maintain that distance. That's part of, we know that's going to happen as long as it's brief, lasting a few seconds. That's okay. And this is also why we recommend masks, the cloth masks when you go outside to decrease any chance you have of those sort of brief interactions as well.
Thank you. This is from a family. I see other families of parents and children walking close together. Do family members need to practice social distancing when they are presumed healthy and living together?
We generally recognize that it's going to be near impossible for family members to stay socially distanced when they're feeling well. And in fact, I would suggest that with children, that's almost impossible to do. And so we don't expect that to happen. But we do recommend that if somebody is sick, to the best of your ability, maintain that distance. I think the biggest challenge is when you have somebody in your household, a child or somebody who's older who needs care and attention. That's going to be, functionally impossible to maintain. For those of us with children, and I know mine, certainly hugs are a part of the day, and they're going to have to be. And so, all of the guidance we suggest is really about decreasing your risk as much as you can.
Thank you. Doctor, from your data, have communities of color been greatly affected by the coronavirus? And if so, how are you reaching out?
It's a good question. We're trying to get a good handle on the data to see what's happening with communities of color. We know, as I mentioned earlier, we know that health equity is an issue in the county. We were working on that. We are working on that, but we were working on that in specific areas prior to COVID-19. And so that's why on Friday we're looking to bring together community leaders to discuss this, to understand understand what's happening in terms of the health and healthcare in communities of color, to see what it is that we need to do to address those equity issues.
Doctor, from the data, can you anticipate when is the surge of cases expected?
That's hard to say. The data is projections, and the projections we have, and there are many different tools online that are publicly available. We know to expect the surge sometime in the next 4 to 6 weeks or so. The peak of it, not the surge itself. The surge itself is a process. The slope goes up, and then the peak is what we're talking about. And so that's why we're taking all these steps in terms of preparation, as you may know, about the hospitals, but also nursing homes and assisted living facilities and other congregate living facilities, to make sure that we have the capacity to care for people. But we can't predict with this exactly what's going to happen. Not only is this a new virus, but a lot depends also on the actions that each of us are taking, and that is going to affect what the future looks like.
Another prediction, I know we can't do that, but what factor or factors will be decisive for Maryland authorities to give an all-clear signal?
I don't really have the ability to answer that question. We have to, that's a question that's going to be coming at the state level, certainly with input from the local level. But there are a lot of factors to consider, and right now our main focus is how do we make sure that we are preparing for the increased number of cases. Part of our thinking is also longer term, but I just don't have the ability to answer that at this time.
Thank you, Doctor. Sandy, how are we all expected to go back to normal after all of this?
Oh, that is a question or a thought that I have given quite a bit of time to over the last several weeks. I think when something as significant an event as this virus has been for us comes about, we start to see time in different ways. It's kind of before and after. So, before, we all know what we were doing before and how we were going about our daily lives. Right now, we're all in this kind of altered state where we're doing some of the things we used to do and some new things and some things that we aren't able to do that we want to. And then I think on the other side of that, it is possible that they're going to be a new normal, as it were. And I hope that we have an opportunity individually to take a look at what are the things that you want to bring to your part of the world when we go back to normal, whatever that normal is. I personally hope that people bring a little more kindness, a little more understanding, and a little more patience to the world when we are finally on the other side.
Thank you. Domestic violence has been reported on the increase since COVID-19. What advice can you give to someone who is a victim of domestic violence now during this time of isolation?
So one of the things that is happening is not everybody is in a safe place when they are sheltering at home. If you are in a place that has not been safe for you or is not safe for you now, the best thing that you can do is to reach out to the local hotline. If you can get to a place where you can make that phone call, there are resources there. There are a variety of resources, from just kind of some coaching and what can I literally do in the next few minutes to how do I manage this long term. The virus is not causing the domestic violence. People are feeling more stressed and more trapped, and that may be so we're spending more time together as well, so that may be leading to some of this increase. So please, if you are in one of those situations, there's a 800 number that we will be sure to get on our website for you that you can call and get some confidential, free guidance on how to handle your particular situation.
We also have a question about substance use and telemedicine or telehealth. Does the health department offer methadone and prescriptions through telehealth?
Okay, so that's a complicated answer. The short version of that is yes. So methadone and buprenorphine are both used to treat opioid use disorders. The Department of Health has several clinics that are doing that offer those services. Methadone, in particular, cannot be provided through a telehealth interaction. The counseling associated with it can be and is being done via telehealth, but the actual methadone dosing or getting the medication is being done in person. So that is being handled on a case-by-case basis. So the number of take-homes, it's pretty highly regulated industry. So we're following those guidelines to try to minimize the number of times people have to come out of their house and the number of people that have to be in a clinic at any one time. In terms of buprenorphine, there has been some relaxation at the federal level of some regulations. So buprenorphine is available via telehealth, and you can contact our Wellmobile and get an appointment. We have a phone number that you can call. I'm only going to give one phone number today to reach the health department for behavioral health because I think it's easier to have one number to remember, and we'll just get you where you need to be. But you can call, leave a message, and someone will call you back and get you connected with our Wellmobile services. Our Wellmobile is virtual at this point, so it's not actually a Wellmobile that you're going to see traveling around. It's parked in its garage right now. One of the things, if you are somebody who is interested in getting started on buprenorphine, in order for us to do it through telehealth, you have to have the capacity to do a video conference. So if you have any questions about that, just give us a call and we'll help work you through that and see if we can come up with some options that you can access a telehealth portal. The number to call for the Wellmobile or for any of our services is 410-222-0117. And one of our clinicians will be back in touch with you, kind of walk you through that whole process.
Thanks, Sandy. Oh, this question came up. Doctor, once you have had COVID-19, how long will the immunity last?
Great question. So we've only known about COVID-19 for about 4 months now, so the jury is still out on how long that will last. We know that other coronaviruses, immunity lasts from about 9 to 12 months, so that's our guess, but we'll actually just have to see how long it lasts, how long the immunity lasts for COVID-19. So there's no firm answer yet to that.
Thank you. Face mask. How much protection does a face mask really give me, and should I make a face mask at home?
So the cloth face masks, and it depends entirely on how you make them. But the idea behind the cloth face mask is that you have multiple layers of cloth, and the more layers you have, and we generally like to see at least 4 layers, the more useful it is in filtering virus out. And the best way to think of it is this: it's both to help you and to help others. So if you have it, having the face mask will help prevent you from transmitting it to others. And at the same exact time, if others have it and you don't, it'll help prevent you from getting it. I think the big challenge we have is that we're learning that people who have COVID-19 don't have any symptoms can still transmit it. That's something that we're learning, and that's really what the guidance for the cloth masks came from. You can make a cloth mask. You can make one without sewing. I'll do one for you right now. They end up looking like you're robbing a train back in the 1910s, but they work. And it takes a couple of minutes. You only need a few things. You need a bandana, roughly about 20 by 20 inches, or you can cut up an old t-shirt to that size. If you have a coffee filter, it's helpful, but don't feel like you need to go buy one for this case. It just adds extra layers. You need rubber bands or hair ties. I have young girls in my house, so we have 1 million of these. They put these on my arm before I went. And a pair of scissors. That's kind of all you need to do this. Take your bandana, and lay it out. You fold it in half. You want to take your coffee filter, you want to open it up, cut off one end, open it up, and you're going to put it right in the middle here. And you're going to take this top part, you're going to fold it over. You're going to take this bottom part and you're going to fold it over. And what you'll see is that we've created a lot of layers here. There's over 6 layers here, and that's really what makes this effective. Last piece is you're going to take one of these, and if you don't have these, you can use rubber bands. Put it on one end. Put the other one on the other end, and then you fold these ends over, and then you're going to use these two as your ear loops, and then you'll just adjust it to either loosen it or tighten it to make it so that it works on your face. And you just put it on like this. And now you have a homemade face mask.
Wow.
That's about how long it takes. And I can't make stuff, so I made it. You can do it too.
That's great. Now, how often and where should we wear the mask, doctor?
You should wear those masks, and these, like I said, these are meant for the public. These are not meant for healthcare workers at this time. And we don't recommend that if you're going about your daily activities that you use surgical masks or N95 masks. Those are to be reserved for healthcare workers and first responders who need it as part of their work. But we recommend that you wear it when you go out, when you go out of the house, and you do that because you're not quite sure what situation you're going to end up in, and so that's why we recommend the use of that. Obviously, there are some limitations. If you have breathing difficulties, we don't recommend it, but we would also advise you caution in terms of where you're going. We don't recommend it for anybody with any anatomical abnormalities, children under the age of 2, or obviously if you're running or biking and we see a large spike in those sort of solitary exercise activities, a mask might not be practical. So, but in other cases when you're going out, please consider using a mask. We strongly recommend it.
Doctor, you say children under 2 years old shouldn't be wearing the face mask, but how do you protect the infants and the toddlers?
And that's where we would advise you to limit their exposure to others, limit how often you take them out of the house. This is a challenge for all of us, as Sandy has certainly talked about. Not being able to leave where you're staying is challenging, and in tight quarters, people want to get out. And so with children, it's even more so important because it's hard to keep a mask on. And while we say under 2, I fully recognize that keeping a mask on a 3-year-old is something akin to a miracle, right? So think about it. Think about where it is that you're taking them. I used to go grocery shopping with my daughters every Sunday, and we don't do that anymore. They can certainly wear the mask, but we've had to change our activities. So really only take your kids out for those, particularly your small children, for those essential activities which require them to go out.
And are certain fabrics more likely to protect you than others?
There are some fabrics that are more helpful than others. We see that wool is a little bit better than cotton, and denser fabrics are better than more loosely woven fabrics. The more layers you have, the better the protection is. So even something like cotton, if you have enough layers, is going to work fairly well.
Now, doctor, is there a risk in accepting a homemade face mask from someone who may have COVID-19?
It's a great question. We recommend that if you get a face mask from somebody else, that you wash it. Any mask that you make should be washable. Otherwise, it's a disposable mask at that point, and you can't be disposing of that many masks. Even if you make your own, whether you make your own or get it from somebody else, you want to wash it frequently. If you're using it just for short periods, you're not coming into contact with anybody else, every few days is good. If you're coming into contact with a lot of people, we would recommend that you wash it every day.
Thank you so much. As I mentioned at the beginning, this is National Public Health Week. And are there some messages about Public Health Week that you would like to tell our viewers, Doctor?
So National Public Health Week is an opportunity to highlight the various public health activities that we take in the communities. In normal times, we'd be talking more about environmental health, how we're protecting the waterways, food, housing. We'd be talking about early childhood and maternal and infant health, how we're making sure that mothers and infants get the nutrition that they need, how we're preventing other types of diseases, not just COVID-19, but through vaccinations, how we're focusing on behavioral health, of course, and Sandy has talked about that quite a bit, how we're looking at suicide prevention, early intervention, harm reduction, those types of programs. And then school health, of course, which is a critical part. Those are functions that we undertake every single day. And the key to all of that is prevention. Public health is really focused on how do we prevent disease from happening. And so looking beyond just how do we take care of something after it's happened, but pushing upstream to the prevention. And that's a lot of what we talk about even now in the setting of COVID-19. How do we prevent it? How are you taking steps to prevent getting it? And then what do you do if you do get it? And so the key take home here is that I think each of you is a part of that. Each of you is a part of promoting public health. The actions you take, as we see now, are impactful. Well, even after we get through the worst of COVID-19, your actions are going to matter. So think about how you can take those steps to improve your health and also those of others around you.
Thank you. Sandy, do you have some positive words to say about public health and public health workers?
Absolutely. The team that I have the privilege of working at the Department of Health with is just phenomenal. They are dedicated, they are passionate about what they are doing, and I certainly, as a director for behavioral health, think that hands down my behavioral health team is the best because they are the best. But I would extend that to everyone in the department. The work that public health workers do is very often a calling. You see them learning things like how to make a mask out of a bandana and embrace your inner train robber, I guess. I am trying to learn to make a bandana with pleats. That's not going well. But I think that just recognizing that there are a lot of unsung heroes out there, both at the department, working actively on COVID, keeping the things going behind the scenes, trying to keep the information available for the community out there, that it is a wonderful team to have working on your behalf, and they are working on your behalf.
And I would add that there are over 700 people at the department, and our entire job is to make sure nothing happens. So our biggest victory is when nothing happens. It's a strange thing to celebrate, but that is our goal.
Thank you. In closing this afternoon, this is not only Public Health Week, but a time of the Passover and Easter holidays. We all need a space to be vulnerable and to talk about what we are going through. Sandy, please stay in touch with your loved ones. Be prepared, be diligent, be informed, be supportive. We can surely get through this pandemic, more than 6 feet away, but together. Thank you for joining us this afternoon. You can still submit questions to us at covid19info@aacounty.org. Take care and wash your hands.